Do you always have a stuck bowel, feel bloated, or use laxatives non-stop? I'm Dr. Johann Wilhelm, a specialist in diseases of the intestine, rectum, and anus, and from today I want to help you. If these problems are affecting your mood, your health, and even your work, I have solutions that can transform your life. Stay with me and discover how small changes can make a big difference to your well-being. Imagine that our body is like a city, full of important places. The coloproctologist is the janitor of a special part of this city, the large intestine, the rectum, and the anus. These parts are like the streets and avenues through which the remains of what we eat pass. The large intestine, for example, is the main street that turns what is no longer useful into feces. The rectum is the end of this road, where everything remains before being eliminated. And the anus is like a door that opens for the body to clean itself. The coloproctologist makes sure that everything works properly in this part of our body. If something goes wrong, such as pain or bleeding, he is the specialist who investigates and solves the problem. He knows how to keep these parts healthy so that our inner city keeps running smoothly. So, when you feel something different, it's time to call this specialist, who makes sure that traffic in the body's neighborhood continues to flow smoothly. Imagine that suddenly in our body's neighborhood, the large intestine, rectum, and anus, problems start to appear, such as bumpy streets or signs that something isn't right. That's when the coloproctologist comes into play. They treat diseases such as Crohn's disease, which affects the large intestine and sometimes the small intestine, causing inflammation that can hinder digestion. It also takes care of hemorrhoids, which are like bumps in the veins of the anus and rectum that can hurt and even bleed. If someone has anal fissures, which are small cuts in the skin around the anus, the coloproctologist resolves this discomfort. He acts as a detective, investigating what is causing the symptoms and then treating them with medication, minor surgery, or lifestyle changes. In other words, when something doesn't go right in the neighborhood, the coloproctologist knows exactly how to fix it. Now, let's talk about an area that's a little less well-known but super important, the perineal region. It lies around the anus and is like the backyard of our neighborhood, the large intestine, rectum, and anus. Even though it's not often talked about, when something doesn't go right there, the discomfort can be great. The coloproctologist takes care of problems such as fissures, which are small cuts that cause a lot of pain, especially when going to the toilet. Another condition is perianal abscess, which is an infection that forms a pocket of pus and can be very painful. And sometimes this infection forms a tunnel, called a fistula, which needs urgent treatment. This specialist also treats external hemorrhoids, which cause itching, pain, and even bleeding. The coloproctologist knows every detail of this area and knows exactly what to do to treat any problems that appear. So if something is bothering you there, they're the right person to restore comfort and health to the area. The coloproctologist also carries out important tests to prevent diseases. One of the best known is colonoscopy, a test that allows you to look inside the large intestine and rectum. Using a thin, flexible camera, he can detect polyps, which are small lesions that can become cancer if they are not removed. This test is essential for those aged 50 or over, or for those with a family history of colorectal cancer. In addition to colonoscopy, there are other preventive tests, such as the fecal occult blood test, which can indicate minor internal bleeding. Rectal examination is also common and helps detect problems in the rectum and prostate in men. These examinations may seem uncomfortable, but they are very important for detecting diseases early on when they are easier to treat. Prevention saves lives, and by having these examinations regularly, you ensure that everything is working well in the neighborhood of the intestine, rectum, and anus. Imagine that to take care of a city full of streets and avenues, you need a specialized architect. A coloproctologist is exactly that, a specialist who understands every detail of the colon, rectum, and anus. They have spent many years studying how these parts of the body work and how to treat any problems that arise there. Let's get to know Anna's story. She had been experiencing pain and discomfort for months, but was ashamed to talk about it. One day, she decided to see a coloproctologist. There, she discovered that the specialist was much more than just a doctor. He knew exactly what to do to solve her problems. With a quick diagnosis, Anna began treatment, and soon her pain disappeared. This doctor is trained to perform procedures such as delicate surgeries, removing polyps, and treating hemorrhoids, always with the utmost precision. What's more, they know how to guide each patient with dietary tips and habits that help prevent future problems. Just like the architect who knows the secrets of the city, the coloproctologist understands everything about the body's neighborhood and is always ready to solve any unforeseen problems. If you experience discomfort when you go to the toilet, notice blood in your stools, or feel pain in the anus, it's time to see a coloproctologist. These symptoms can be signs of problems in the colon, rectum, or anus, which need to be assessed by a specialist. Even minor symptoms such as itching or swelling shouldn't be ignored, as they could indicate conditions such as hemorrhoids, fissures, or even more serious diseases such as colorectal cancer. Tell me in the comments, have you had these symptoms or do you know someone who has? It's also important to see a doctor if you have a family history of intestinal diseases, such as Crohn's disease or ulcerative colitis. People over the age of 50, or those who have risk factors, should have preventive examinations, such as colonoscopy, even if they don't have symptoms, in order to detect problems early. The coloproctologist can also help guide changes in diet and lifestyle habits to improve intestinal health and prevent the onset of disease. Making an appointment when you notice any symptoms is essential to ensure that your health is always up to date. Prevention is always the best medicine, and the coloproctologist is no different. The health of the colon, rectum, and anus can be maintained efficiently with a few simple measures and regular checkups. Prevention involves adopting habits that keep the digestive system working well, and, of course, having regular checkups to make sure no problems are developing silently. One of the most important forms of prevention is maintaining a diet rich in fiber. Fruits, vegetables, and whole grains help regulate intestinal transit, preventing problems such as constipation, which can cause anal fissures and hemorrhoids. Drinking plenty of water is also essential, as it helps to soften the stool, making it easier to pass through the intestine. The coloproctologist also recommends screening tests, such as colonoscopy, for early detection of diseases, especially colorectal cancer. People with a family history of cancer, polyps, or inflammatory bowel diseases such as Crohn's disease should have these tests regularly. Early detection significantly increases the chances of effective and less invasive treatment. For those who have already had a condition treated, such as polyps removed or hemorrhoid surgery, ongoing monitoring is crucial. This involves regular appointments to check that the disease hasn't returned or that new problems are emerging. Patients with Crohn's disease or ulcerative colitis, for example, need constant follow-up to adjust treatment and avoid complications. In addition, the coloproctologist educates patients about the importance of maintaining healthy habits and paying attention to the body's signals. Changes in bowel habits, bleeding, or persistent pain should not be ignored. Continuous monitoring helps ensure that any changes are identified quickly, allowing for early intervention. With a prevention plan and proper monitoring, you can keep the health of your bowel, rectum, and anus up to date, avoiding major problems in the future. A coloproctologist is at your side to ensure that everything works well in this important part of the body. Now that we have a better understanding of the role of a coloproctologist, it's important to remember that taking care of the intestines, rectum, and anus is essential for our general health. This specialist doctor works on several fronts, from diagnosing and treating diseases to carrying out preventive tests such as colonoscopies. They are also present for ongoing follow-up, ensuring that any problems are detected and treated as quickly as possible. Now, I want to know, have you had your preventive colonoscopy? If not, it might be time to think about it. Take care of your health today to avoid problems tomorrow. And if you like this content and think it might help someone, share the video and leave your comment below. Don't forget to subscribe to the channel and turn on notifications so you don't miss out on more important health tips. Let's take care of our inner neighborhood together. If you identify with what we've talked about today and are looking to improve your intestinal health, be sure to subscribe to the channel. Here, you'll find much more valuable content to help transform your quality of life. And don't keep this information to yourself. Share it with friends and family who can also benefit from these tips. Together, we can achieve better, more balanced health. See you in the next video.